like as a PT, if I have back pain, then I'm a failure because I should know better, right? And it's like, come on, we're human, right? Okay, so you expressed primarily the issue over here on the right side, correct?
No,
or it's bilateral.
Evil.
It's evil.
It is evil.
It's evil. Okay, so she's got some evil base of tongue tension, and it affects you during your workday and when you sing.
Usually end of work day to after.
Okay,
Yeah.
and what about with singing? Does it take a lot of singing, or can you elicit it quickly?
I can elicit it pretty quickly, particularly if I've already worked that day and then I try to sing that night. It'll be pretty quickly that it starts tensing up and getting kind of painful.
Got it. So it impairs your singing?
Yeah, I would say that it does. Yeah.
Okay. So as you today, right now, as you've been talking and everything, do you feel it? Do you feel that feeling?
Yes.
Yeah. Where is it?
Like inside.
Mm-hmm. Yep. Can you touch it?
No.
No. So when you do that, when you poke and prod.
Kind of.
Kind of.
I feel it. I do this a lot. And then I can feel it at the back of my tongue.
And what do you feel? So what do you feel at the back of your tongue?
Stretch when I
Got it.
do that.
Okay. So, if she's my patient, and this could be a patient, right? As an SLP, this could be my patient. I get sometimes performers coming in with end of performance issues, etc. Right? So we're going to be starting base of tongue work here. What we're doing tomorrow after lunch, we're doing tongue work itself, which if you've not pulled tongues in this way, it's some pretty cool work, right? But I don't know what it's going to take to connect with her. What I'm doing right now may be less meaningful than something else, but we're going to run through it anyway. So there is, I should have said this before I brought you up here. If there's anybody in the room who has singing issues that they can immediately feel the negative feeling and is willing to sing for us, it just adds to the experience.
Sure. That's fine. Yeah.
Do you mind?
Yeah. No.
Would you be able to feel it if you sang right now?
Possibly.
Can you take yourself to a place where you can find it? Whether it's a note or a volume, can you take yourself to that place right now?
Mm-hmm, yeah,
Do you mind?
It's higher pitches. If I'm, like that's, I feel it more there.
So you feel
I can feel it when I do like a, like I feel it get tighter at the top of my range.
And that's part of that posterior.
I'm also nervous. So.
Yeah, no, I understand. Thank you for doing this because it's asking a lot. But you felt that posterior pharyngeal feeling right there. Go there again.
Yeah. Yeah, I feel as I go up the back of my tongue, like it almost feels like it widens, if that makes sense. I don't know, like it gets really tight and wide, and then the posterior pharyngeal wall also just feels super tense. Super tense,
and that's familiar to singing, end of the day, that sort of thing. What she just did there, I'm really careful. She just said, if that makes sense. Like somehow they have to make it make sense to me. And whether it's a professional doing it or patients do it all the time to us, they don't want to sound silly or anything. So how do I make this make sense to you? Often a patient will say to me, and I'll stop him, I said, don't. Tell me what you're feeling. It's my job to make it make sense. You just tell me what you're feeling and experiencing. And I think that sort of takes the pressure off, because sometimes they'll start to talk in my weird, it's like a crap basket back there. Right? But honestly, they'll start to talk in those phrases that they're afraid they might get laughed at if they said it to a professional. Okay? Don't try and make it make sense. Just tell me what you feel. Right? So right now when you did that, how bad was that?
Probably at like a 3 or 4 right now.
And it gets to?
A 7, 8.
Okay. And when it gets to a 7 or 8, what strategies do you have?
That's when I stick my tongue out.
That's when you stick your tongue out. And then that will help in the moment for a while?
Yeah. It's pretty short term though. I would say it helps like maybe less than a minute. It helps like pretty immediately. She's given us benchmarks right there. I'd record that as a benchmark, right? Patient says self-efficacy treatment of sticking the tongue out helps for about a minute, right? Maybe our work can make that work for 2 minutes or 5 minutes, right? Or maybe
she'll find there's less of a need for that, or everything else. Like, I document everything like this, because those are the benchmarks. I want to go for the functional benchmarks as much as I do for the objective benchmarks, okay? And I know as clinicians, we're supposed to be identifying the objective benchmarks, but to me, the function-based ones mean so much more to the clinical dialogue that I'm trying to have with her, right? Okay, anything else you want to share on that? Okay, so now that you've stopped, do you still feel it?
Yeah.
Okay, because what I'm going to be striving to do is to bring you back in contact with that feeling. Are you okay with that? Mm-hmm. I ask that because sometimes patients will say no. Let me be hypothetical. A patient's coming to see me with a migraine, who gets migraines, and they come to me seeking help. And I'll say, okay, well, let's see what we can do. And they'll say to me, is there any chance you're going to trigger a migraine? And I answer completely bluntly, and I'll say, it's happened twice in my career. It has, right? Whether it was the timing accidental or whether I caused it. But I just say twice it's happened, and then I shut my mouth and I let them make the choice. Because I've had a patient say to me, then I don't think I want to do this. Because the threat of that is simply too much. Now, this is minor, but I want to let her know that, you know what, you might feel it. Are you okay if I bring it to your awareness? I'm not going to try and provoke it or take you over the edge, but I want to take you to the edge of awareness of it. And if you're okay with that, then we're going to try it. You okay with that? Mm-hmm. Okay. What would you like to ask her? Put your clinical hat on. What do you got?
Well, I experience a lot of clinical symptoms as well. And so, I guess I want to also ask, like, do you try to explore in that area and see if, like, you can manually release it? And if so, is that any benefit for you?
Yeah, I do. I feel like I do quite frequently. Like, I'm always like poking around in here, like constantly, and wiggling my larynx. Yes. I mean, I think it like pushes it off essentially. Like, you know, I don't struggle with it all day long, but I do a lot of talking and a lot of singing and working on a voice all day long, and then I feel like by the end of the day it's kind of inevitable, particularly if I sing. If I'm not singing, it's not so bad, but yeah.
So you have some clear-cut benchmarks that you can identify change with, correct?
Yes.
Yeah, good. And that's important, right? Cool. Yeah, what else you got? Anything? Because, you know, there's things we're going to want to know. Have you gotten this checked? Have you gotten that checked? By the way, as a physical therapist, if somebody comes to me with a new voice issue, I ain't touching them. They're getting sent back to the specialist, the ENT, to get checked out. I know I know my limits. Okay, I want that to be crystal clear. Okay. The other piece is if they think there's something going on in there that somebody's not checked out, boop, we're stopping. You're going to go get checked out. I'd rather cry wolf than just say no, we're fine. It's nothing. Yeah.
I always ask about, you know, have you been to an ENT for any reason? Have you had any operations in this area? Mm-hmm. Also, what was the onset?
Yeah. Sudden onset, gradual, new, old, all those things. Yeah. Do you?
I don't know if you know an onset, but.
Yeah.
Oh, yeah. I mean, I can answer that. So I have sang my whole life and never had a problem. I really feel like it's been since I've started, like, working in voice therapy and doing an 8-hour day of voice work, it's gotten like noticeable to the point that it affects my voice like later in the day.
Okay.
Yeah.
So would you have any ability, if you get up off the table, do you think you'd be able to feel change if change was there, or does the issue happen too sporadically to be able to say for certain?
It's not sporadic. It's pretty much.
It's there.
Yeah.
Okay. Right. Good. Again, when she gets up off my table, there's a lot of issues at play, or a lot of potential factors at play besides the stuff that I did with her. There's expectation, there's internal pressure to feel change, all those things. And I recognize that. All right. Anything else? Yeah.
I guess has it been kind of like static? Like, do you feel like the feeling has stayed the same since onset, or do you feel like it's been changing? Has it been worsening over time, or something different?
I don't know 100%. I mean, I feel like it's gotten worse, like recently, but not. I don't think it's been consistently getting worse. No, I think it's kind of hit a plateau at this point.
Is there any point that you have swallowing issues?
I don't know. I feel like all SLPs that work with swallowing, like I aspirate all the time, right? Like I think that's something you just like notice it more because you work with it. So I don't think so necessarily.
Okay. So we're going to start. We're going to have the camera on. If you can't see, say something. If you want to come on up. Just don't block other people. Okay. The camera should be showing you what you would like to see of what's happening up here. And if not, then let us know and we'll reposition the camera. All right? But please, if you can't see wherever you're sitting, just either reorient yourself in the room or kind of come around the edges so you can get a better view. All right? Okay, so what I'm going to be doing is, and again, I'm going to treat you like an actual patient, and I'm going to be putting my hands on this part of you in here. And we're going to be trying to do a little bit of pressure or stretch to see if we can connect with and possibly do something to help some of those issues you talked about. Are you okay with that?
Yeah.
Okay, good. All right. And for those of you who haven't tried the chalk yet, give it a try. You don't have to use it. You don't have to love it. You don't have to share my feeling of addiction to it. But especially when we get up into the neck area where there might be more skin moisture by in and of itself. If I know I'm going to be working with somebody with the head and neck issues, I'm going to pre-warn them or pre-request that they come in dry. No makeup or lotion or oil. But sometimes people forget or they forget. Right? And the chalk really does a decent job to overcome some of that. But here, let's pretend a patient comes into me and they forgot and they're lacquered up, right? And they feel me slipping and sliding. Once she gets the idea of why I asked her to come in dry, typically they'll comply next time, okay? All right, so let's get you